Pregnancy care is on the cusp of a revolution. A revolution with the INVU Complete Telehealth Solution for the remote administration of fetal surveillance procedures, including non-stress tests. The prescription-initiated, FDA-cleared INVU pregnancy monitoring and management platform enables a direct remote connection between expectant parents and their healthcare providers.
We're a tech-forward kind of practice, so this kind of speaks to our kind of mission. We always want to have intelligent and compassionate care, and I think this adds to the intelligence of the care and maybe a little bit of the compassion piece, because a mom who was stressing about getting here, now we take the office to them.
Live sessions using self-applied bands are designed for accurate, reliable, and safe signal acquisition, even with high BMI.
Use of the belt is very easy. You just snap it on, and then you utilize it with your mobile device. That's how I used it. And the connection was very easy. It's very simple to use. And it's wonderful. You get to hear the baby's heartbeat on the phone.
Physicians establish remote sessions at convenient times for live monitoring.
If need be, they can even do asymmetric type visits where they can just upload things, and maybe not in a contemporaneous visit, but they're feeling better because we're getting more data on their pregnancy.
The data captured during readings is compliant with HIPAA privacy and security regulations. The INVU method of fetal heart rate monitoring demonstrated a highly significant correlation between fetal heart rate measurements from INVU and TOCO. The INVU method of remote uterine activity monitoring has been validated to show a high sensitivity to the gold standard IUPC and superiority to TOCO, and INVU was unaffected by BMI.
I consider INVU quite safe. In fact, I think it increases the safety profile for pregnancy, especially in those patients who say we may have at home on bed rest for placenta previa or something of that sort, where they don't have to violate the bed rest to come see us, as well as it increases the communication touches between us and the patient throughout a pregnancy. So yes, I think INVU is quite safe.
The INVU device is a wonderful tool for prenatal care. I loved how convenient it was, how versatile it was to use. I loved that I was able to look back on my blood pressures and my baby's heartbeats to trend the information. And I love that it improved my access to care.
For us, it opens up our schedule for those patients who really need to be physically present, where we can triage, if you will, those patients who don't need direct in-office care. So we're able to evaluate our more, I don't want to say acutely ill patients, patients in need of direct face-to-face services. And I think overall it reduced, the stress level on the practice and our infrastructure.
To support platform implementation, Nuvo provides staff and patient training.
We know what the process is, but we really weren't encumbered with any of those technical aspects. Mostly we were seeing our patient on a video call, and we'd have the strip and the vitals to review. I would probably have the posture that everybody is a candidate for INVU, and then work backwards from there. Anybody who would want it, we would offer it to. So going forward, we're always going to have a block of time just for a remote. For a busy practice, part of the mechanics of medicine is you need to provide patients with clinical staff. Well, the tech takes the place of clinical staff in some instances where the office is at home and you're sitting at your home or somewhere remote, so you're not really encumbered by geographic boundaries. So it's allowed us to have more patients in our panel, but in a less stressful way.
INVU could be the solution for those ready to evolve their practices to conduct remote pregnancy monitoring and expand their geographic boundaries of care. INVU was developed in an attempt to improve work efficiency and reduce the significant burden of busy clinical staff.
As a matter of fact, a lot of times I would schedule my INVU sessions at a certain time frame, say on a Tuesday afternoon or Friday afternoon. If you're an OB/GYN and you're practicing and you're at home at the same time, well, that's kind of a win-win for everybody, right? Happy doctor, happy patient, happy doctor's family. Yeah, maybe it'll decrease burnout. And I think on the bigger picture of medicine, I see this as leveraging the physician workforce in the United States to where maybe there's an area in an inner city or in a rural area that doesn't have great services nearby. Well, this kind of obviates the need for the physical brick and mortar.
Nuvo. Give life a better beginning.